Welcome to the American College of Surgeons Bulletin Brief from the Frontline Surgeons' Voices. With me today, it is with pleasure that I introduce Dr. Richard David Glick, an Associate Professor of Surgery and Pediatrics at the Zucker School of Medicine at Hofstra Northwell in Long Island, and Director of Surgical Oncology at the Cone Children's Medical Center. Welcome, Dr. Glick.
Thank you. It's a pleasure to be here, Dr. Wexner.
Well, it's a pleasure to have you here with us, Dr. Glick. And the reason for our little conversation today is about the new pediatric standards,
Right.
you being one of the group that convened to create these new standards. Could you please tell us what is the history behind it? What is the impetus for it?
Yes, I was really Dr. Nelson's idea to bring together a group of pediatric oncologic practitioners, surgeons and oncologists, to sort of look at the current standards for cancer programs in the United States that were really adult standards, and to look them over and change them somewhat and amend them to be pediatric based. And that's what we did over a year or two, and came out with new standards for pediatric cancer programs specifically.
Interesting. And what predated the standards that are there now? What was the
Well, that's what's so interesting, is that you did have a pediatric cancer program. You could have an affiliation or accreditation. However, all of the standards were really adult based. And as we both know, the ideas of pediatric cancer care and issues surrounding pediatric cancer are very, very different than adult. So there was not a robust affiliation. In fact, only 13 or so programs were accredited as pediatric cancer programs, and some of the very, very large and busy programs were not accredited. And that's because everyone thought that these standards didn't really apply to children's hospitals or children's cancer care.
Interesting. Can you give us a couple of examples, some of the standards that are the key ones and that are in particular different than standards for adult oncologic surgical care?
Absolutely. Firstly, and we had to think of how to phrase this, was the idea of the age groups on which patients get treated. So there is a statement of what ages can get treated, from ages 0 to 18, as well as young adults. So the thought is to be accredited for a pediatric cancer program. One can't just treat late teens and young adults, but really take care of little kids with cancer. And so that had to be first and foremost. After that, we had to look at really who makes up the people taking care of the kids with cancer. And so we had to look at everything from pediatric subspecialists like radiologists, head and neck surgeons, surgical oncologists, medical oncologists or pediatric oncologists, radiation oncologists, all to make sure that they had adequate training for taking care of children. And so that is really the main crux of it, along with some other things such as cancer screening. In adults, we screen different types of people who are at risk for cancer, like previous asbestos workers or smokers. But in kids, the screening is really for kids who have syndromic issues. And so it really is a little bit different. And we had to make sure that we put that into the standards.
Sounds like the multidisciplinary team aspect is critical to the program from what you just said.
Absolutely. So there is, as with the adult programs, there's a cancer committee, but also there's a multidisciplinary cancer conference that meets regularly. And you have to have evidence that at those conferences, there's all types of people able to take care of kids. And this also includes standards in pediatric oncologic nursing, not just the medical types.
So what are some of the metrics that you'll be able to use to determine that your objectives are met, that you've improved outcomes?
That's a good question, because things are very different in pediatric outcomes and so forth. So we are going to take a look at national outcomes, and we make sure that each program is affiliated or associated with the Children's Oncology Group to meet the standards of practice of the current state of the art of taking care of kids with cancer.
Okay, so it's really kind of broad, as it were, rather than narrow focus for
It is because
specific ones.
with the adults, there's comparisons with the National Cancer Database. But in children, the NCDB isn't quite as good or specific to children because our staging is very different. And so it could be that into the future, we may try to adapt or change the NCDB slightly to be more children cancer appropriate.
Okay. And the accreditation process, has the accreditation process already begun? Or
No, it hasn't quite begun. It's supposed to begin in 2023 with the first accreditations happening, the new ones at least, towards 2024. And importantly, there could be two types of accreditations, one for a primary pediatric cancer program, which is more of a freestanding children's hospital. And the second type of accreditation could be for an adult hospital that is accredited with the Commission on Cancer, that has a particular expertise with pediatric cancer as well. So that's sort of two different ways to get accredited.
so CoC accreditation is a prerequisite for application for accreditation in an adult hospital.
That is correct.
Seems
That is
very
correct.
akin,
It's sort of a secondary accreditation
very
in
akin,
pediatric.
very akin to the National Accreditation Program for rectal cancer.
Oh, is that right?
Yeah, but that's our first standard is a mandatory CoC accreditation. Now, the last question, are the standards available at this point?
Yes, in fact, if you go to the college website, you have them all, and then near to the end, you have the pediatric specific standards, and that will tell people the pediatric specific standards that have to be met.
What is your prediction for the number of programs that will or perhaps should seek accreditation?
It's a great question. It's a little bit difficult to answer given the lack of response to pediatric cancer programs right now. With the new standards, we believe that children's centers and large children's hospitals and places that treat a lot of children's cancers will want to get accredited, very similarly to the pediatric level 1 accreditation and the recent children's surgery verification by the American College of Surgeons. So we really think that we can get 50 or 100 centers at least to sign up.
Well, thanks very much for telling us about the newest kid on the block for standards, and lots of room for growth there, puns clearly intended. And thanks for your time and reflections today.
You're welcome. It's a pleasure to be with you, Dr. Wexner.